Good afternoon, everyone, and welcome to the Health in the Public Interest Seminar. I'm Adrienne Fu-Berman, and I co-direct the Happy MS program with Dr. Adam Myers. And our aim is to create advocates for a better healthcare system. And there's no one who's a better example of that today. I'm going to turn this over to Addie Fowl, who will introduce our wonderful speaker, Byllye Avery, today. Addie?
Hi, sorry, technical difficulties. Hi, everyone. My name is Addie Fowl, and I am one of the lucky students in the Health in the Public Interest program. And today it is my absolute privilege to be introducing Byllye Avery. Ms. Avery is a lifelong healthcare activist and founder of the National Black Women's Health Project, which is now known as the Black Women's Health Imperative, which is an organization exclusively dedicated to improving health and wellness among Black women. She earned her BA in psychology from Talladega College and went on to receive her master's in special education at the University of Florida, Gainesville. But then she found her true passion, which is improving healthcare and health education in the Black community. In the early 1970s, Ms. Avery began participating in consciousness raising groups and legal abortion referral services, and went on to help open the Gainesville Women's Health Center, the first abortion and gynecology, can't say that word, care in the city. She went on, she later continued her work in reproductive health and justice, and she went on to found Birthplace, an alternative birthing center in Gainesville, Florida. While on the board of directors for the National Women's Health Network, Ms. Avery started a 2-year project called the Black Women's Health Project, which eventually led her to found the National Black Women's Health Project, which is now known as the Black Women's Health Imperative. The goals of the Black Women's Health Imperative are to make Black women's health an imperative for federal and state governments, to work to eliminate health disparities that exist for Black women, to ensure that Black women have access to reproductive health options, to reduce high death rates among Black women for preventable causes, and to increase health insurance coverage for Black women and their families. Byllye is the recipient of the MacArthur Foundation's Fellowship for Social Contribution, the Essence Award for Community Service, and the Ruth Bader Ginsburg Impact Award from the Chicago Foundation of Women, amongst many other accolades. She is also the recipient of the Addie Fowl Coolest Speaker of the Semester Award, which is an award that I just made up specifically for her. Ms. Avery is an amazing activist and advocate, and we are so lucky to have her speak with us today. So without further ado, I'm going to turn it over to Byllye.
Thank you, Anna. That's so funny. Cindy, what are you doing here? Anyway, there's this little baby over here that is just so wonderful. The Africans say whenever we have a baby present, we will have a future. So thank you, Maya, for having that wonderful little girl sitting there looking at me. She is so delightful. Good morning, everyone. Thank you, Adrienne, for inviting me. And we're just thinking we go back a long time ago in our history. And I was just talking about what it's like to be a part of the old people now. You know, we used to be the young whippersnappers, but now we've moved into the background while a lot of you are taking over the charge. I want to start off, I want to talk a little bit, and then I want to remember and open it up for questions, because I want a dialogue. I like a dialogue rather than that straight kind of, y'all get enough of didactic stuff, but I like a little interaction because it makes everything a lot more exciting. I want to talk a little first about activism. And I have a thing about A is for activism. And activism is what saved my life, what gave my life meaning, what gave it purpose, what provided me with a job doing something that I thoroughly loved. I never had a day that I hated going to work. I never worked for anybody but for women first, and then for Black women specifically, they were all my bosses. So, you know, you can have a life as an activist and feel very, very fulfilled. And there are many ways to become an activist. Some of you, I hope that many of you, most of you will become activists. And sometimes you get there through some sort of traumatic event. And I'll talk about the traumatic event for me. You get there through something that happens to you. Think about the thing that came to my mind. I don't know why I don't know if it's a great example, but M.Ed, the Women Mothers Against Drunk Drivers. Some driver killed some woman's daughter, and she got mad and organized a whole movement around alcoholism and driving. So is Amber Alerts, and a lot of these things that we have come out of an experience that someone had that just made them so pissed off that they had to do something about it. And so that's the kind of thing we need, because as you know, we're living in some very, very difficult times, and you are going to have some tough jobs out there, but it's always tough no matter where you are, whether it was us in the 70s trying to working for women's rights and legalizing abortion, reproductive health, and all of that, or whether it's now in the 2000s um, when we are not only trying to fight the same fight that we've been fighting since the 70s. I can't believe that some of these issues are still around. You know, I kind of had a kind of Pollyanna attitude that once we got something passed by the Supreme Court, you know, that it was going to be ours forever, not knowing that we were going to have to take up the fight. And then the idea of the whole democracy in the country that founded democracy would be threatened has just been a bit much to grapple with. So as you can see, we need a lot of you to make a decision. Everybody don't have to be in the streets carrying banners. There are scholar activists. You could be an activist right where you are in your local community. And I'm still, in case I forget to say this later on, you all run for office. Run for local offices, run for school board, run at the county level, run at the state level, run at the federal level. We need to run for offices. That's where a lot of the power is. And you don't have to think you don't know enough. You know enough already. Mabel Thomas was 19 years old when she joined the Georgia legislature, and she is still there. So, you know, take the attitude of the men. You don't know it, you'll learn it. You know, and you'll get there. So don't think we think we need to be totally prepared and have every I dotted and every T crossed. You don't have to. You can learn it on the job, just like everybody else, and go in there. So a little bit about how I got started. I mean, I was a special education teacher by training from the University of Florida. And I think I actually did that work maybe 2 or 3 years, not much more than that. And then I got connected. I was teaching, I was at the University of Florida in the Children's Mental Health Unit, working with kids who had autism. And our unit was headed up by Paul Adams, who was a Quaker and a person who lived in the future. And one day he asked 2 of us, me and Judy Levy, to give a talk about what was happening with women in reproduction. And so when I realized we had to talk about abortion, I was really scared because I didn't know what my mother was going to think it was going to say to me if I was talking about abortion, because we didn't talk about abortion, you know, nowhere around us. And people didn't even say the word. It was like, well, they didn't even say pregnancy much. She's in the family way, you know, or they threw the baby away, you know, but never the word abortion. And so someone pulled me aside and said, hey, you got to get your act together. Here, you on a job, you a grown woman, and your boss telling you to do this. And what a good thing my boss did tell me to do that, because from that presentation I did with Judy Levy, it sort of led us to women started coming to us and asking us where could they get abortions, and we didn't know. But you know, when you get anointed as an expert, you become the expert. So that's a hint. When you are anointed as an expert, you become an expert. And and so we found out about clergy consultation, which was a group of Catholic priests in New York who were helping women get to New York for abortions. But when a Black woman came We tried to give her the telephone number, and she said, well, I don't have any money. I don't know anybody in New York. And, a month or so later, she died from a self-induced abortion. This is a time which probably many of you can't even imagine, that women, not only did we not know anything about our bodies, we had no access. I mean, birth control pills didn't even exist when I was a teenager, and they came on later. I was a grown woman when all of that happened. And we knew nothing about how to take care of ourselves, and how to prevent pregnancy and all. And so the way you prevented it was you just abstinence. You didn't do anything. You kept your dress down and your legs crossed. Well, that worked for some people, but not for others. My own personal birth control was, my mother told me if I got pregnant, she'd kill me, and I was going to Talladega College. So it worked for me, but not for everybody else, because I was scared. I knew, so fear was used. We opened up, three of us. I'm going to tell you a little bit about how we did activism at that time, our strategies. We got together, we would meet at Judy Lever's kitchen, sitting down at a table. I just think the kitchen table is the best place to get a lot of stuff done, and planned out how we would open up a clinic for women in Gainesville, Florida. And so we got the little money together, asking our friends to give us money. We found a facility. We've got machines from doctors in Jacksonville. We found out what was good medicine practice. What were the things that we should do? And we conceived the clinic out of a way that we wanted to be treated. And we didn't ask the medical society for permission to open, because they had turned Planned Parenthood down several times, and we knew they wouldn't let us open. So we just opened it up, and they read about it in the Gainesville Sun like everybody else, and they were very, very upset. But they could do nothing, because we had everything in place. The doctors who performed the abortions were residents who came from University of Florida and other medical schools, and they liked it because the information that we were teaching them as young doctors, they were not getting in school. We had one resident who didn't know what a clitoris was and had no idea what the function of the clitoris was. They didn't know how to do pelvic exams. We had a nurses teaching program in which nurses would teach them how to do pelvic exams. They'd before been doing them on women who were anesthetized. So there was a lot of learning, and they were real open, and we got the services that we needed. Now, while we were there, women started they wanted to have birth at home. White women were very disenchanted with what was going on in terms of birth, and they wanted home births, and many of them started having their babies at home. And that prompted us to, and then when after the babies were born, they would bring them to us to examine, because other doctors didn't want to touch them because they wasn't born in a hospital, and our doctors would see them. It was crazy. But then the medical society called us on the mat when we opened up our birthing center in '78. So we had to go before them, and this is what I want you to know. When we went before them, we couldn't play like we didn't know, like we did with the abortion clinic, because we were the same women and we knew. So we went in with a court reporter. And the court reporter was really on our side, and she was so intimidating to the doctors, whenever they would say something, she was recording, and she said, would you repeat that, doctor? And they got all nervous and everything. And they turned us over to Shands Teaching Hospital at the University of Florida for us to work with them. And we were able to open the clinic. So I'm telling you these little things because you are going to have to figure out some of the devious ways in order to get stuff done. You just have to keep your game up and keep thinking. The birthing center was quite wonderful, and and I won't go through that whole process, but a lot of one of the things we learned that you don't hear much is that, first of all, pregnant women need a lot of love, a lot of attention, a lot of time, a lot of information about what's happening with their bodies. And believe it or not, the whole family is interested in this pregnancy. It's not just the woman. So we opened the doors and brought the men in, the children. And at the time of birth, the whole family moved into the birthing center. And children were present at birth. Men caught the babies, they weighed the babies, they cut the cords, they did all of this. And it was really looking at birth as a social issue and not necessarily a medical event. It was a social event more than a medical event. Of course, we had the midwife there who had all of her emergency supplies tucked in a clothes closet. That was all that was needed. And women were able to give birth in many positions, some in the bed, some on the floor, some on all fours, some in the lithotomy position, some on their side. So with midwives and all. And so I really learned so much at that time. I learned a lot about life. I learned about death. Many babies are born on their daddy's birthdays. I don't quite understand that, but it was just an incredible experience. So I say to you, young women, when you get pregnant, think about having an incredible birth experience and plan it. Think about it. Don't be, you're going to be a little bit scared. I was terrified, but be scared anyway, but just do it and enjoy it, because it is one of the miracles of what we have. And it helps you understand so much about life. And it just is the whole pregnancy, childbirthing thing is a wonderful time because we're not sick at that time, and we're all doing very well at that time. It's a wellness thing, not a sickness thing. So I left the birthing center and actually started back teaching at a community college, and it was there that I became really aware of the health issues of Black women, because I've been working in the women's movement primarily around reproductive health, and not so much around the entire physical health. But when I got there, I found these young women who were in their 20s who some had babies way too young, some were hypertensive, they were diabetic, and I was kind of shocked that these young women had so many health issues, because when they would miss school, I would call them in and say, well, what's happening? And they would tell me about these issues. At that same time, I was on the board of the National Women's Health Network, and we have Cindy Pearson here today and Adrian, where I met all of them during that time. And and while I was there, I planned on making a 1-hour presentation to the network about Black women's health issues. But after I read the statistics, I realized a presentation was not what was needed. We actually needed a whole program. We needed a whole movement. I didn't think movement because that probably would have scared me at that time. I just took it one little step at a time. But I knew I needed to get the word out to Black women about what was going on with our health. And I had attended, I think it was in 75, I attended the Our Bodies Ourselves conference in Boston that brought together health activists and people from all over the world and dealing with issues. And that was one of the best conferences I've ever gone to in my life. And even now today, it is still remains with me as just a place where I gained an awareness that was just unbelievable in terms of helping me shape my life. So my idea was to organize a conference similar to that, and for 2 years, we met at Spelman College and planned the first national conference on Black women's health issues. And we thought we'd have 200 to 300 people coming. We had close to 2,000. So people were ready to deal and people were ready to be there. And that conference, oh my God, it just, I can't believe that we're getting ready. We just talked last night about celebrating our 40th anniversary in in 22, and I don't know if it's quite 40, but anyway, we're declaring it. And and it's hard to believe that it's been that long. But I used to ask the questions: what's the difference between Black women's health issues and white women's health issues? And then I came to understand that there was criticism of white women in the movement for not talking about issues that affected us as Black women or other women of color. But I came to understand that when you think about these issues, you think about them from your perspective. And from white women's perspective, that's what was important to them at that time. It didn't mean that it wasn't important to Black women, but it wasn't what was at the top of the Black women's list. So we have the same thing on the same list. We just might rank the priorities in a different way. So I think that probably one of the most important things that we did was to talk about the role of ethnicity in terms of health and how you look at health, as well as encourage other women of color organizations to start looking at health through their perspectives. And that led us to connect with people like Luz Martinez, who did the Latino women, Sharon Asatoya, who did the Native American women, and so on down the line. And we were able to do it. So today, you see all of these groups that are dealing with women's health issues in their own way, from their perspective. And I always felt it was important for us to learn about each other's issues, so I could talk about what Native American women's issues were, and I could talk about what the Latinos were dealing with, so that we would all know, as well as they could talk about us, and we could talk about all of us as women, as a group, and learn how to really work for real systemic change. Back at the Black Women's Health Project, we needed to hear our stories because we hadn't been talking out loud about who we were and what was happening. We didn't know what was going on in our lives because we had been taught whatever's happening with you is your business and you keep it to yourself. But we came up, I met a woman named Lily Allen who had been doing work with reevaluation counseling. And that is a kind of a co-counseling situation where you learn active listening and you learn how to share and you learn how to do that really without interrupting the person and giving them time to tell their stories. So we told our stories to each other for about 15 straight years. And we did that so that we could then learn what our issues were, so that we Black women could be validated that no, we are not crazy, that we are experiencing racism, that we are experiencing violence in our community, sexual, domestic violence, and all of this, and then we could look realistically about how we needed to change. So we had like self-help groups in about 32 states. We expanded our work in Africa, in the Caribbean, and in Brazil. And we connected with women all over the world and basically using storytelling. That is one of the things I want you all to remember to do. You first need to hear somebody's story. And everybody has a story to tell that's uniquely theirs. And telling it, even if you tell it 100 times, you will think of something different each and every single time. And it's very important to do it in the presence of someone who is respectful, who you have confidence in. And as I said, even in self-help, you don't have to say anything that you wouldn't want written on the front page of the New York Times. So the main thing is, people say, oh, I'm scared I'm gonna say too much. Well, then, you're in charge of your mouth, your thinking, your everything, and you might get to it. But as you start to see what the issues are, you start to know that it's not you, but that we have some real serious problems in our communities around violence. Like right now with COVID, I just can't imagine what's happening to women who are victims of domestic violence, being shut up in the house with these mean men who are beating them, and you don't know, you can't go anywhere, you can't do anything, COVID might be worse than this, you know what I'm saying? And all over the world, there is a big increase of domestic violence, which was one of the big issues that we never talked about. And it was hard because when we started talking about domestic violence, I remember my mother being beaten by my dad. I remember at least 3 or 4 times that it actually happened. And I tried to talk to her about it. And my mother sat there and said, "No man has ever touched me." And I'm wondering, what? I could not believe it. So people like shut all of that off. They close it off. That was the only way they could deal with it. And, I wasn't going to call my mama a lie. I just had to learn that that's how she sealed it off so she could deal with it. Fortunately, I wasn't a victim of sexual violence, rape, incest, of all of that, but many women talked about this. This was the dominant talk for many folks. So, and also what they didn't talk about was getting abortions. And so why would you can talk about the worst kind of sexual abuse, but you cannot talk about abortion. And still to this day, it's not something talked about freely. But lucky for us, now we have reproductive justice organizations. I don't know, we got about 10 or 12 of them, maybe even more around the country that's working on reproductive justice, who are outspoken, who are connected to their voices. But let me just tell you, it wasn't always that way. And that when you step out sometime as an activist, you threaten your family. And so you have to think about being strong and how it's going to be. In my own family, when my son called me up and said, "Mom, I need to get some money because I need to." And his wife his girlfriend at that time needed to have an abortion, and I didn't have any, And so he said, "Well, I guess I'll have to ask Gigi, who was my mother, who all of a sudden said, 'Well, let me help this boy because he got to learn to put a raincoat on that thing.'" But she came up with the money and she did it. This is the person who would even come to the abortion clinic while I was there, who came to the birthing center, who still wouldn't say the word, but she gave him the money because she knew that was something that was needed. So you have that kind of thing going on, Not everybody can put their words to where their heart is, and especially the role that religion plays in our family. And my mother was a church-going woman and everything, but she had her little things that she did. She wasn't perfect by any means. She had her life, and that's what you need to tap into. But you need to be strong. Because if you hang in there, they'll come around. Or if they don't come around, you just have to deal with that too. But as in my case, they did. But part of being an activist is learning about who you are and being able to go into some dark places and being able to really examine all of who you are and not be afraid of it, and know that it's you, and know that it's okay. And then if you look at some of that, that will inform you of how you think about what kind of work we need to be doing in terms of activists. It just will come over time. So we formed the Black Women's Health Project, and we were based down in Atlanta. And we organized all of these groups, and we had a real good run for about 15, 20 years with the self-help groups. And then it became a change happened in terms of funding, and some other things happened too. And some happened with me. I got very, very, we kind of grew real fast. And you don't have anywhere to go to activist school where people teach you how to do things. You're kind of like learning it on your own and figuring. And it was time for me to move on and start doing something and have some new leadership. And the biggest thing for me to realize is that this struggle for women's health, for changes in healthcare system. We're dealing with a very, very big ship, big like a yacht, and you just can't turn it around. And that this is a journey that is really lifelong, generational. So none of us are meant to carry this from the beginning to the end. Like my son said to me when I told him I was organizing a nonprofit, he couldn't understand why you want to organize a nonprofit in the first place. And then he couldn't understand why you want to do work that at the end of the day, it's not done. He thinks at 5 o'clock your job should be done, and you start over the next day. So I said, well, I don't think there's any end to this. And he was just baffled by how would anybody take something that there's no end to it. But we're not meant to finish it. We're meant to finish our part. And then there's someone else to take it to the next stage and someone else to take it to the next stage. So some of you are going to be some of those people who are going to be picking up the mantle and taking it to where you're going. But just know you're not meant to be there forever. So you do the best you can, you do whatever you can, and you make this work happen. And I'm gonna say this one next thing, and then I'm gonna stop so we can have some talking together. We got like another hour or so. Is that right? So, because I want us to talk more together than me, and I'm willing to talk about anything. Y'all can ask me anything you want, and and I'll let you know where I stand on it. But now we have, I don't know, I don't even know how many Black women's organizations we had. Back in the day, there were only like 3 or 4 of us who would come together to even talk about reproductive health or to talk about abortion or to talk about health. And none of those organizations, except for us, are really visible in terms of that front now. But we got a bunch of new Black women who have taken on the reproductive justice mantle, which sort of came out. I know y'all all know what reproductive justice is. If not, y'all can go and read that. But that sort of all came out of our beginning talks around Black women talking about the realities of our lives and understanding and telling our stories. I cannot emphasize enough how important storytelling is. This is one of the most valuable things that we have, because when you talk, you want to talk from the lived experiences. And so that's what these new groups are doing. And a lot as Angela Davis, who was very involved with us, was saying the other day about all the political movement among Black women. She said a lot of that grew because a lot of the foundation was laid through the work that we all did together in the 80s and the 90s with learning about our power, learning how to love ourselves, learning how to value who we are in the face of people not valuing us, and claiming who we are as Black women, as being powerful, as being bold, and not necessarily being willing to be the mules of the world anymore. And to know that we are brilliant, we're strong, but we don't have to take everybody's crap just because we're strong. And so what you have today is a whole kind of collective psyche. I mean, and nowhere was it ever this when, like, 98% of Black women voted against Trump. And so, so that means that we are kind of in a place, I wish I could say that for white women. I still don't understand what's happening with 50 some white women, 50% some white women voting for something like that. I just can't get it. But anyway, but we as Black women are a cohesive group. And somebody said the other day that that Black women saved Georgia and saved democracy. And so and so I'm just saying that it is not enough just for one group to be powerful. Everybody has to access their power and not be threatened by power from anybody else. That because you are powerful It doesn't mean that I'm powerful, doesn't mean you powerless. We are both powerful together. And that is the way that we're going to reach to some kind of human rights, some kind of way that we can live together in peace, because our big job on earth is to learn how to live and work together. And we are failing on it. We are failing. So at that point, I'm going to stop, take a sip of water, and y'all, Addie, you ask whatever, okay?
Cool. That was amazing. I know you already have kids, but if you ever want another daughter, I'm always available.
All
You're
right.
amazing.
Okay. All right. You can be one of my daughters. I take them on all the time.
Cool. Well, first I was just going to ask if there are any questions that any happy students wanted to ask in particular. I know I have some prepared, but I just want to make sure that everyone had the opportunity to say something. So just if you want, just drop it in the chat. I'll say something. So you said something about earlier about not having, or there's no school for activism. And I think Dr. Fuberman said in the chat that Happy kind of is an activist school of some kind. That's what we're trying to do through the program. And I was just thinking, so I know a lot of my peers in the Happy program are looking to go into medical school. I think Felicia's one of them, Divya maybe. So I was thinking, how do you think you could incorporate this kind of like activism and advocacy for Black women's health into the actual medical practices of doctors, physicians, healthcare workers in general?
Well, first of all, I think one of the things that back in the 70s when we started, one of the first things we did is we went over to the University of Florida and we found the women medical students and we brought them over to the Gainesville Women's Health Center so they could meet each other. You know, they'd been there and they kind of seen each other. They were all feeling alienated and bad because at this time, you know, medical schools were full of men and they were very anti-woman and all. So the first thing to do is to first get to know your cohort and you all hold on to each other and form some sort of supportive atmosphere for each other. That I think is the first thing. I think also it's easier to get connected with physicians who at this point are dealing with provider bias, which seems to be the big thing that's happening. I know the chair of our board is a physician, and she ran on a platform of wanting the organization to deal with physician bias, because as a physician, she hears it a lot from other physicians and all. But I think one of the best things is that when you get your patients of color, listen to them. Don't think you know what they are going to say. Give them time. Listen to them. And if you don't have time to listen to them, hook them up with somebody you work with who has time to sit and listen to what they have to say so that you can establish a relationship with them so that it can be trusted. Because one of the things that is broken down in terms of a lot of people of color in medicine is a lot of the disrespect that people feel when they come in. I mean, back in the 70s, we called it MD. To the doctors were gods. We didn't know anything. They would tell you your pregnancy is none of your business. You know, it's mine. You know, and all that kind of thing. And I meant to say, Carol Dowdell got started as an activist to help start the women's health movement because she went for a Pap smear, and she asked the doctor put the speculum in. He was looking. She asked him, could she see what he was looking at? He told her it wasn't his business. Wasn't none of her business. And when he went out of the room, she stole his speculum and went home and got a flashlight and a mirror and looked at her cervix, and the women's health movement was born. So I'm telling you, never downplay an action. But I think being present. But the first thing the providers have to do, deal with their own racism. We are all races, everybody, Black, white, people, color, every kind of thing. We all have these tribal feelings. We all have these things inside of us, okay? So it's not just one set of people that have them and one set don't. But deal with your own biases. Be willing to question yourself, and be willing to be present with people. Be present and be honest.
Amazing.